Okay, ask them to come in. Now we have only 11 students. Total student is 18. I believe you all have the slide already, correct? I have given you all.
Yes, Doctor.
Okay. Should you wait or we start now? 12 friends only. 12 of your friends are here. I think we start now, okay? Can I?
Okay, sure.
Okay, when we talk about drug for dyspepsia. What is dyspepsia? Dyspepsia is indigestion. Okay. Well, let me put it into big slide first. Then, what is indigestion? Indigestion is a sign of underlying problem such as gastroesophageal reflux disease, ulcer, or gallbladder disease, rather than condition of its own. Also called dyspepsia, defined as a persistent or recurrent pain or discomfort in the upper abdomen. So, symptom of indigestion: burning in the stomach or upper abdomen, abdominal pain, bloating, there's a full feeling, belching and gas, nausea and vomiting, acidic taste, growling stomach, and this symptom may increase in time of stress. People often have heartburn, a burning sensation deep in the chest, along with indigestion. But heartburn itself is a different symptom that may indicate another problem. So you have a guideline. What do you do? First, if there's someone compare a dyspeptic symptom or indigestion, first you check whether there's a heartburn or regurgitation are present. You must check about the chief complaint and whether it's predominant or frequent. If it then managed as gastroesophageal reflux disease, we are giving of acid suppression agent. Number two, whether the patient is a usage of NACID or COX-2 inhibitor. If yes, consider discontinuing NACID and switching to another agent or adding proton pump inhibitor. If there's a dyspepsia, without obvious gastroesophageal reflux disease or NACID, then you go to figure 2. Okay, so if it's age more than 55 or alarm symptom are present, you need to do a esophageal gastroduodenoscopy. If it's age less than 55 and there's no alarming symptom, you test for Helicobacter pylori through the breath test, whether it's positive or negative. If negative, you just give proton pump inhibitor trial for 4 to 6 weeks. If it's positive, you treat for Helicobacter pylori. And after the trial of proton pump inhibitor, if it fails, you need to do a reassurance, reassess the diagnosis. And you should consider for EGD, which is a esophageal gastroduodenoscopy. It's a scope. Then we start about step 3, esophageal gastroduodenoscopy in patient after failed empirical therapy, which is medical therapy. There are 2 findings. You have to check whether the endoscopy is normal or abnormal. If it's abnormal, you need to do biopsy or treatment based on the endoscopic finding. If it's a normal endoscopy, consider rapid urine test or histology for Helicobacter pylori. Number 2, you need to do culture and sensitivity testing if previously treated for Helicobacter pylori. If Helicobacter pylori detected, you do a salvage therapy. It's negative, go to figure 4. If it's negative, means this patient are having functional dyspepsia, something wrong with the mind. So if it's Helicobacter pylori negative, this is a functional dyspepsia. We check whether it's a normal endoscopy. And they also feel an adequate trial of proton pump inhibitor. What we need to do, we need to reevaluate the symptom and diagnosis. Consider other source of abdominal pain, which can be pancreatic, colon, or biliary tract. Number 3, does the patient have symptom of delayed gastric emptying? Number 4, does the patient can be irritable bowel syndrome? We will cover all that in later lecture. All we can ask is that whether the patient has panic disorder or psychological issue. If the symptom persists and no other cause established, we should consider antidepressant, hypnotic therapy, behavior therapy or prokinetic agent. So this is a normal guideline for dyspepsia. Okay, so we talk about treatment for dyspepsia and gastroesophageal reflux disease. One of the treatment can be over the counter. So while we have a few medicine over the counter, one is antacid. Number two is a H2 receptor blocker, and others also under the group of proton pump inhibitor. So first, you have antacid that neutralize stomach acid, such as Milanta, Roloid, and Tums, may provide quick relief. But antacid alone won't heal an inflamed esophagus damaged by stomach acid. Overuse of some antacid can cause side effects, such as diarrhea with magnesium or kidney problem with calcium hydroxide. Medication to reduce acid production, this medication known as H2 receptor blocker or histamine 2 receptor blocker includes cimetidine, known as Tegamet, famotidine, known as peptide, nizatidine, known as acid, and ranitidine. H2 receptor blocker don't act as quickly as antacid, but they provide longer relief and may decrease acid production on the stomach for up to 12 hours. Stronger versions are available by prescription. Then number three, we have medication that block acid production and heal the esophagus. This medication known as proton pump inhibitor, a stronger acid blocker than H2 receptor blocker and allow time for damaged esophageal tissue to heal. Over-the-counter proton pump inhibitor include lansoprazole, such as Prevacid, and omeprazole, Prilosec, or Zegerid, which is over-the-counter. Then we have treatment for dyspepsia and gastroesophageal reflux. This one is more towards prescription drug. So we have prescription strength H2 receptor blocker. This includes prescription drugs such as famotidine, also known as Pepcid, nizatidine, and ranitidine. These medications are generally well tolerated, but long-term use may be associated with a slight increase in risk of vitamin B12 deficiency because they disturb the absorption of vitamin B12 intrinsic factor in the stomach, and bone fracture because they can lead to osteoporosis. Then you have prescription strength proton pump inhibitor, include esomeprazole, known as Nexium, lansoprazole, known as Prevacid, omeprazole, known as Prilosec or Zegerid, pantoprazole, known as Protonix, rabeprazole, known as Archipex, and denslasoprazole, known as Dexilant. Although generally well tolerated, this medication can cause diarrhea, headache, nausea, and vitamin B12 deficiency. Chronic use might increase the risk of hip fracture and loss of acid production. Then we have medication to strengthen the lower esophageal sphincter. Mecloflan may ease gastroesophageal reflux disease by decreasing the frequency of relaxation of the lower esophageal sphincter. However, this drug can cause fatigue or nausea. Then we have other medication for dyspepsia. We can give a prokinetic. What does a prokinetic do? Boost the movement of food through the stomach via peristalsis. For example, metoclopramide under new Reglan, but their side effects are tiredness, depression, anxiety, and muscle spasm. Then we have antibiotic for Helicobacter pylori, such as amoxicillin and clarithromycin, together with omeprazole, which can be a triple therapy, which is used to treat Helicobacter pylori. Side effect of antibiotic can be stomach upset, diarrhea, and fungal infection. Why fungal infection? Because once you take antibiotic, the patient can be immunocompromised. And then when we talk about antidepressant, we can give amitriptyline, a tricyclic antidepressant, a problem with CNS leading to digestive problem, also known as functional dyspepsia. Side effect is headache, dry mouth, constipation, drowsiness, and nightmares. Alternative treatment for dyspepsia or gastroesophageal reflux. Other than we give drugs, we can do other procedure. One of the procedure that we can do is fundoplication, whereby the surgeon wrap the top of the stomach around the lower esophageal sphincter to tighten the muscle and prevent reflux. Fundoplication is usually done with a minimal invasive procedure. They call it as laparoscopic procedure. Just cut a small hole and insert a laparoscope. The wrapping on the top part of the stomach can be partial or complete. Number two, have a LINX device. It's a ring of tiny magnetic bead. It's wrapped around the junction of the stomach and esophagus because so that they can act as a sphincter for between the stomach and esophagus. The magnetic attraction between B is strong enough to keep the junction close to refluxing acid, but weak enough to allow food to pass through. The LINX device can be implanted using minimally invasive surgery. Okay, this one I have finished. Drug on dyspepsia. I just want to tell you all that you all will have exam on test 1. Test 1 will cover 3 MCQ and 1 single best answer from me. And this topic will be covered from drugs for dyspepsia and drug for vomiting. Okay. Can I continue with drug for vomiting? If it's okay? Can?
Can.
No. Can clear? The lecture is clear. Okay. Goodbye. Okay, today we talk about anti-emetic and anti-nausea agent. Anti-emetic is another word for vomiting, and the other one is anti-nausea agent. So definition, you must talk about definition first. What is nausea? Nausea is unpleasant feeling that often precedes vomiting. Emesis is vomiting, possibly emptying of gastric and occasionally intestinal content. Anti-emetic agent is used to relieve nausea and vomiting. So how does vomiting occur? Vomiting occurs when there is because we have a vomiting center which is triggered in the chemoreceptor trigger zone, both located in the brain. One stimulus stimulated causes the vomiting reflex. Mechanism of action, there's many different mechanisms of action. Most work by blocking one of the vomiting pathway, thus blocking the stimulus that induce vomiting. So indication, we need a specific indication which is vary from each class of anti-emetic. General use of anti-emetic is prevention and reduction of nausea and vomiting. So first we have one of the common drug is an anticholinergic agent, also known as acetylcholine blocker. This drug is good in the sense that it can be used for motion sickness, whereby if you want to go for a trip with a ship or cruise, we should be taking this drug. And how does they do? It binds to and block acetylcholine receptor in the inner ear labyrinth. It blocks transmission of nauseating stimulus to the chemoreceptor trigger zone. Also block transmission of nauseating stimulus from the reticular formation to the vestibular canal. Example of this drug is scopolamine. It's used also for motion sickness, but the side effects such as dry mouth, drowsiness, dizziness, constipation, and itchiness, which is part of the anticholinergic side effect. Then you have a antihistamine agent. This blood previously is a H2, now it's a H1. H1 is receptor blocker. It inhibits ACH by binding to H1 receptor. It prevents cholinergic stimulation in vestibular and reticular area, thus preventing nausea and vomiting. Example of the drug are diphenhydramine, meclizine, and promethazine. Diphenhydramine, the brand name is Benadryl, meclizine, antivert, promethazine, Phenergan. That's why a lot of people take Benadryl or Phenergan when they have cough. Also used for non-productive cough, allergic symptom, and sedation. Side effect of diphenhydramine is drowsiness, dizziness, constipation, dry mouth, stomach upset, and blurred vision. Means what you see is not clear. Then you have another drug is a neuroleptic agent, because they call it neuroleptic agent because it acts on dopamine. What does it do? It blocks dopamine receptor on the chemoreceptor trigger zone. One of the drugs is chlorpromazine, CPZ, known as Thorazine, prochlorperazine, known as Compazine, and phenothiazine. It's also used for psychotic disorder or intractable hiccup. Side effects of chlorpromazine include dizziness, restlessness, agitation, nervousness, and tardive dyskinesia. Tardive dyskinesia means abnormal movement with prolonged use. Then you have prokinetic agent. Prokinetic agent, what does it do? It blocks dopamine in the chemoreceptor trigger zone, cause chemoreceptor trigger zone to be desensitized to impulse it receives from the GI tract. Also stimulate peristalsis in GI tract by enhancing emptying of stomach content. One of the drug is metoclopramide, also known as Reglan, also used for gastric esophageal reflux disease. What does it do? It delays gastric emptying. Side effect of metoclopramide is nausea, vomiting, headache, confusion, malaise, and restlessness. Even though this drug can help, sometimes it can also lead to nausea and vomiting because all these are mixed activity. Then we have a serotonin. We have another one is a serotonin blocker. What does serotonin blocker? It blocks serotonin receptor in the GI tract, in the chemoreceptor trigger zone, and in the vestibular cochlea. The drug are dolasetron, granisetron, and ondansetron. Dolasetron, the name of the drug is Enzamet. Granisetron, the brand name is Titrel, and ondansetron, the brand name is Zofran. It's used for nausea and vomiting for patients receiving chemotherapy and post-operative nausea and vomiting. Side effect of dolasetron is dizziness, fainting, bradycardia means that the low heart rate, weak pulse, slow breathing, and anuria. Anuria means loss of production of urine because they act on the serotonin receptor on the GI tract as well. Then we have another one is a substance from marijuana. Marijuana is a form of opioids, but they are used in treatment of resistant disease. One of them is tetrahydrocannabinoids, which is a major psychoactive substance in marijuana. It has inhibitory effect on reticular formation, thalamus, and cerebral cortex. It alters mood and body perception of its surrounding. Marijuana, for example, dronabinol, also known as a trademark of Marinol, is used for nausea and vomiting associated with chemotherapy, and anorexia means loss of appetite associated with weight loss in AIDS patients. Side effect of dronabinol is stomach pain, nausea, vomiting, anxiety, confusion, and insomnia. Side effect of the drug vary according to agent use. Why? Because of the non-selective blockage of various receptors. Then antiemetic, we have thought example, okay, this one is important. Anticholinergic is scopolamine, H1 antihistamine diphenhydramine, dopamine inhibitor phenotazine, prokinetic metoclopramide, serotonin inhibitor ondansetron, marijuana, dronabinol, and another drug that can use is corticosteroid known as dexamethasone. Because of that, that's why you can see that corticosteroid is anti-inflammatory and can be used for many diseases. And corticosteroid is known as a miracle drug. Okay. Anything you want to ask me? This is all about the nausea and vomiting.
Doctor,
Yes.
can we use morphine for antiemetic?
Yes, we are, morphine can be used because, but the problem is antiemetic is that morphine sedate, but sedate so it's not suitable because morphine is a sedative agent. So once you antiemetic, but you sedate the patient less conscious, then you have that the blockage of can cause blockage of the lungs because of aspiration from the GI tract.
Okay, doctor.
Doctor, I get question also.
Yes, anything?
Is it the proton pump inhibitor can cause cancer? Because there is a certain article says that can cause cancer.
Proton pump inhibitor has prolonged use of proton pump inhibitor cause one great problem, which is loss of acid production. Once loss of acid production is known as process of achlorhydria. Once the achlorhydria happens, then it prolong reduction on when there's no acid production, it can lead to cancer.
Okay, thank you, doctor.
Okay. Anything else? Or else I want to ask you all one thing. Practical will be conducted by Dr. Basi, correct? Because online difficult to do practical.
Actually, we don't really know about that, doctor.
Okay, I will ask him later on when I see you.
Okay, thank you.
Anything else you want to ask me? Because I think this lecture, I have make it simple because for pharmacology, the most important you must know is what class of drug that you use together with the mode, action, and side effect. Okay, so you must know for the drug that you use first is an antacid. But antacid we will cover in a later chapter when we talk about peptic acid disease. Then the other one is a what we say H2 receptor antagonist, which are cimetidine, ranitidine, and the most important drug is omeprazole. Because why? Omeprazole is a class of proton pump inhibitor, which we will use as triple therapy for
peptic ulcer.
Okay. Anything else?
So, doctor.
So you all must get ready for exam, okay? I give you a hint. My exam, I will ask questions about simple one. Example, what is example of first lecture anti-dyspepsia medication? So which of the following are anti-dyspepsia medication? Then I will ask about the side effect, and also I will ask about mode of action. So roughly, the test one for me will cover 3 questions, MCQ, and 1 single best answer. Okay.
Doctor. Okay, doctor.
Okay. Good luck for it. If anything, please, if you have anything, you have any problem, please feel free to contact me. Okay. Thank you.
Thank you, doctor.
Thank you, doctor.
Okay. We see our class next week.